Welcome back to Family Planning and Abortion for Medical Students. Today, we will be continuing our mini-series on family planning and contraception by talking about long-acting reversible contraceptives, otherwise known as LARC methods for short. We will continue to cover the following learning objectives from APGO's Topic 33, Family Planning, including the mechanism of action, risks, benefits, and effectiveness of contraceptive methods. I will not be covering counseling directly, but have linked resources in the course folder. This is our main learning objective for today. Again, here are the 5 major categories of contraception. We will be discussing what these methods are, how they work, how effective they are, advantages, disadvantages, and contraindications. A more comprehensive document with absolute contraindications for these methods from the CDC is in the resource guide as well. You can also get this information on your phone through an app called Contraception, which may help on your OBGYN clerkships. LARC methods include implants, injections, and intrauterine devices, which are also referred to as IUDs. All of these devices, besides the copper IUD, release progestin and prevent pregnancy through a similar mechanism of action. The implant is a small plastic rod that is placed under the skin in the upper arm and left in for up to 3 years to prevent pregnancy. The implant releases progestin. There have been a few different types of implants in the past, but currently in the US, the only one on the market is called Nexplanon. Like the mini pill, it thickens cervical mucus and thins the lining of the endometrium through the use of progestin. It is more than 99% effective. Advantages include being cost-effective, safe, maintenance-free for 3 years, easily removable, and private from a partner. Disadvantages include needing a clinic visit for implantation, no STD protection, it can cause irregular periods and bleeding, abdominal pain, and breast tenderness. A birth control shot is when a patient is injected with progestin every 12 weeks to prevent pregnancy. You may hear this referred to as Depo-Provera or just Depo. It is 91% effective, more so when the shots are given on time. Advantages are that it is safe, fairly low maintenance, as coming into the clinic for shots is only required 4 times per year, private, and can give lighter periods and less cramping. Disadvantages include that it does not provide STD protection, needing to see a physician every 3 months, some reverse lowering of bone density, and side effects including weight gain, abdominal discomfort, breast tenderness, and some irregular spotting and bleeding. Something really important to note for patients that want to become pregnant within the next few years is that it can take up to 2 years to regain fertility after discontinuation of the shots. An IUD is a T-shaped device that is inserted into the uterus by a healthcare provider and kept in place by the cervix. There are 2 types of IUDs, hormonal on the left and copper on the right. We'll start talking about hormonal IUDs. They contain progestin that is released locally to prevent pregnancy and can be effective for up to 5 years depending on the brand and dose of progestin. Names you may hear are Mirena, Skyla, Liletta, and Kylena. Copper IUDs have a copper coil wrapped around the bottom of the device that acts as a spermicidal agent and prevents sperm from reaching and fertilizing an egg for up to 10 years. The only one currently on the market in the US is called Paragard. Both of these types of contraception are more than 99% effective. For both of these, advantages include being very safe and effective, cost-effective, extremely low maintenance, can be removed at any time, provide a quick return to fertility, and last for a long time. For copper IUDs, an additional advantage is, as we discussed before, they can be used as a method of emergency contraception. Disadvantages of both types include requiring an in-clinic visit for placement, which can be painful and/or uncomfortable. They don't provide STD protection, and there is some cramping and bleeding after placement. For progestin IUDs, patients can expect lighter periods or no periods at all, whereas copper IUD users can actually experience the opposite and have heavier periods than before IUD use. Rare side effects include expulsion and pelvic infections, but that usually occurs within the first few weeks or months after placement. Thank you so much for listening. Please check out the resources for more information, and don't forget to tune in to the next video. We will be discussing sterilization, a permanent method of birth control.